Hello, I'm Dr. Mark Dailey, and I want to thank you for allowing me to be part of your group, share a little bit of what I know about fibromyalgia. I have worked with fibromyalgia patients for over 10 years, and of course, I simply want to share some of the insights that I've discovered. Let me be clear that what I share on this video is not intended to take the place of your personal physician. That, of course, is between you and your doctor, though I plan to share individual strategies to help reduce the symptoms of fibromyalgia. As I've mentioned on every video, I believe in most cases there is not one thing that's going to cure fibromyalgia. You'll see that a little bit better in this video. In my experience, fibromyalgia is a multi-system breakdown, which basically means it involves the gastrointestinal system, the immune system, the endocrine system, and of course the nervous system and the brain. So that doesn't mean you can't beat fibromyalgia. I believe you can, but you have to do it in a specific order to get the desired results. So the last thing I want to do is pretend like there's a magic pill that I have the cure for fibromyalgia. I have successfully treated fibromyalgia patients, but there is never going to be one pill to cure fibromyalgia, in my opinion. There may be things that help, and those are things that I share with you. One last thing I want to mention before I get into our topic today is that it is foolish to expect results without making changes. Please don't do that. You as a fibromyalgia sufferer have more power than you're aware of. Some of that will become more evident today. Most of you on this forum are eager to learn how to beat fibromyalgia and get your life back. And I hope I can play a small part in that process. The truth of the matter is, however, that you must apply what you learn. No substitute. That may be changing the way you eat, the way you deal with stress, the exercise you do or don't get, and the supplements you take. Today we're going to talk about triggers. Now, triggers are extremely important to understand because in most cases, these triggers are what cause your flare-ups. So, how is it that a trigger causes flare-ups, you might ask? Well, it's their relationship to your immune system. When your immune system is in high gear, it causes systemic or system-wide inflammation. This inflammatory process is responsible for many of your aches and pains, fatigue, sleepless nights, and brain fog, just to mention a few symptoms. There are many factors that trigger inflammation. I'm not pretending that I'm going to cover them all. This is not an exhaustive teaching. But these triggers are found both internally and externally. So they're in our internal environments, in our external environments. That basically means, hey, they're inside your body and they're outside your body. They include excessive amounts of the hormone insulin. So that's a trigger. So what is it that causes excessive amounts of insulin? Well, it is blood sugar instability. So increased insulin can be caused by eating too much sugar or things that turn to sugar quickly. So have you ever noticed that if you lose control and you go on some kind of crazy eating binge, that the next day you pay for it, or the next 3 days you pay for it, depending where you are on the scale of fibromyalgia symptoms? Now, please keep in mind that you have control of this. You can determine what you're going to eat and what you're not going to eat. And my hope is to empower you so you can make a change, so that you can get your life back. Emotional stress can also be a trigger. You don't have to look far for causes of emotional stress, do you? Then there's environmental toxins, heavy metal, free radical damage, viral, bacterial, fungal, and other pathogenic infections. Obesity, overconsumption of hydrogenated oils, which is like vegetable oil. Periodontal disease, yeah, that can affect this overall condition because of its relationship to your immune system. Radiation exposure, smoking, and certain pharmacological drugs. In other words, medications. So these triggers, as I mentioned in the other videos, are vital to understand for the fibromyalgia patient. Literally, understanding these triggers is potentially the answer to overcoming this debilitating disease. So every fibromyalgia patient has hidden triggers that cause flare-ups. That's why most people have good days and bad days. You'll hear on the forums people say, I'm having a bad night, I can't sleep, I have this or that. They're sharing their pain in hopes of getting some answers, but oftentimes the flare-up is the result of these triggers being activated. So there is no substitute for finding and removing the triggers to fibromyalgia or to inflammation. So let's talk about the most common triggers. There are a vast array of triggers, and some will affect you but not other people. Some will affect others but not you. Remember that no two fibromyalgia patients are alike. I mean, you get shoved in this big basket or this big diagnosis, but truly there's big differences between each fibromyalgia patient. But yet there are common denominators, and that's why you've come together, because of those common denominators, and of course to comfort one another. So you each have unique sensitivities and unique triggers. Food sensitivities are huge triggers, and for the patients, these are the things that you have the most control over. Food sensitivities. We'll get into that a little bit deeper in a moment. There are also smells, whether it's perfume, cigarette smoke, essential oils, or toxic chemicals that act as triggers. Fungal infections are internal issues, meaning they're inside your body. Things like yeast overgrowth, things like candida. I'm talking about intestinal yeast overgrowth. It's affected by sugar consumption. Sugar is a fuel source for yeast. So if you are not in control of your diet, you're eating too much sugar, you're hurting yourself in more than one way. There is pathogenic bacteria and opportunistic bacteria that trigger the immune system and cause a variety of symptoms from diarrhea, fatigue, sleeplessness, gastrointestinal distress in general, and a variety of other symptoms. We see parasites more often than you might think. Parasites cause a variety of symptoms in and of themselves. And these are just a few triggers that we commonly see. What they all have in common is that they affect your immune system. They cause it to run non-stop. An immune system that runs non-stop can lead to autoimmune conditions like rheumatoid arthritis, lupus, MS, and the thyroid condition known as Hashimoto's thyroiditis. And I guarantee some of you are shaking your heads yes right now, because you've also been diagnosed with one of the conditions I just mentioned, and it is no joke. You've got to get your immune system under control, and you do that by removing triggers. For today's discussion, though, remember that when your immune system is in overdrive or at a heightened sense, it causes system-wide inflammation, which acts as an amplifier to all of your underlying issues. In this case, the amplifier simply turns up the pain. Now, as a functional medicine practitioner, we need to do two things. We need to identify common triggers and reduce inflammation. Doing just one or the other is not enough. We've talked about a few things that reduce inflammation, like magnesium, vitamin D, curcumin. But as you can see, reducing the inflammation alone without removing the trigger is not going to help you long term. It may relieve some of the symptoms, which has been my hope sharing it with you. So while we're trying to reduce the systemic inflammation with proper nutrition and dietary restrictions, we also find it beneficial to look internally and remove these internal triggers. Let me say quickly, from a food sensitivity perspective, major offenders are dairy, wheat, corn, and soy. Now for others, nightshades may be involved, and really it can be almost any food. There are a whole lot of others that you may be sensitive to. For a lot of our patients, we'll do a food sensitivity panel to determine that. We also look at your gastrointestinal environment using a stool panel. So we're able to detect parasites, yeast overgrowth, bacterial dysbiosis, even pathogenic or opportunistic bacteria. So after talking about these triggers, you need to ask yourself, how many of these triggers affect me? Then you have to eliminate them from your diet if you want to get better. Now we're talking about food sensitivities. So we're back to the fact that there's no magic pill, but there are common denominators, and all of these triggers cause inflammation. If we can reduce inflammation, we can reduce pain, stiffness, fatigue, and even brain fog. But we can't stop there. We've got to remove the triggers. So if you want to know more about the work that we do, you're welcome to visit us at our website. But I want to thank you so much for your time and your attention, and I do wish you the very best of health.